Hi, I'm Becky DPT. Today, let's discuss foam rolling for beginners. The first thing you want to do is you want to pick out a foam roller that has a low to medium density. That makes it more comfortable. It helps to increase your flexibility. It helps to increase the blood flow, and it helps to reduce muscle tension. What you want to focus on is large muscle groups, such as your back, your glutes, your quads, and your calf muscles. So on average, you want to roll about 30 to 60 seconds over an area. If while we're rolling, we hit a sore spot, this is probably due to a trigger point or adhesions in that muscle. So you want to give it an extra maybe 20 seconds over the area. Deep breathe, roll slowly, and allow that area to release. And a couple areas that you want to avoid rolling, you want to avoid your joints, you want to avoid the neck directly or your spine directly. Other than that, let's get started. So our first muscle group we're going to roll is our quads, our thighs. So you start at the top. We're doing both together, and we're going to start at the top of the thigh, and we're going to press, roll down to the knee, and roll back. Again, coming up to the top of the thigh, and to that knee, nice and controlled, about an inch a second. And again, looking for any spots that are sore that we can concentrate on. So the next muscle group we're going to hit up is our hip flexors. This is going to be done individually. So first we'll start out with one side, one knee is bent, and then the other side has the pressure right up in the hip, right where we bend at our hip. So you're going to roll forward and back, keeping that one knee straight, and the opposite knee is bent. So that bent knee is the one that is resting as we roll the one side. Once we hit this side up, we'll straighten that knee, and we'll bend that other knee, and we can roll into that hip flexor. Right there in the front along that hip bone, right where we bend at the waist. So the next area we're going to focus on is our calves, and we're going to do those together. So we have the foam roller underneath just about the ankle, and we're going to use our arms to lift up. We're going to roll out to the knee level and then back. And again, roll out and back. And if we need to, we can use those arms to walk back and forth, or we can come down onto our elbows to make it just a little bit more comfortable. Our next muscle group is our hamstrings. We're going to focus on our hamstrings one side at a time. So one leg is bent up over the foam roller. The other one is straight, and we're going to start about the knee. You're going to lift those hips, roll down to your glute, that back side, and back. And again, nice and controlled, making sure not to hold the breath. And if we hit a spot that is sore, that's when we will stop and concentrate on that area. We can go ahead, drop the hips. We're going to bend that other knee, straighten out that other leg. Again, lift those hips up. You're going to roll out to the hips and then down to the knee. And again, out into the hip and to the back of that knee. Continuing that controlled motion. Our next area we want to focus on is the IT band, that iliotibial band. We have our TFL muscle up in our hip and it comes down into that IT band and it attaches down below that knee. So we start nice and high on the hip and we roll out down towards that knee, using that top leg to just hold and give a little bit extra support. Switching sides, we're going to roll down towards that knee and back out towards that hip. Nice and controlled motion. And again, if we have a spot, stop and roll slightly on that spot until it releases, and then we can go back into those long movements. The next muscle group we're going to roll is our lats. So we want to be on our side. That foam roller is right about the armpit level. We're going to use those legs and push up and roll into your lat and come all the way back down. We can also lean back and we can also lean a little forward to make sure we're hitting those areas needed. And of course, we need to switch sides. So again, on our side, the roller is just about armpit level. We're going to lift up into our legs and roll through and down, roll through, down. We can lean back slightly, get a different roll, and even a little bit more forward to get a different roll in different area. Our last area, we want to roll our upper back. You're going to start about at the shoulders. We're going to roll down and roll back up the back and down, back up, stopping if there's a spot, and we can do just a little roll, then back into that long roll. Hopefully, this has given you an idea of where to start when beginning foam rolling to help increase your flexibility, decrease muscle tension, and improve your function. Have a great day.